A lot of times it's kind of lonely because you go in these classes and you're kind of isolated. There's not a lot of people that look like you, but rather than kind of seeing it as its negatives, I've kind of seen it for its sort of purpose for me and being able to make sure I have my footing and making that impact for people that also look like me, and also making sure that we're not excluded from the impacts that medicine can provide to the world.
I think that this thing is lonely, and it's lonely in ways that you can't even imagine, especially for males, because we're not supposed to show how we feel. We're not supposed to show our sadness and our weakness and our fears. And so the opportunity to be here, to be with other people, to have people that are just starting and see that you're living the dream that they're working toward is motivating me to make sure that we all get together, right? This right here has to happen more, right? So that we can get together and talk about things that bother us and help each other to that next level.
Black men in medicine is critically important to the future of healthcare of a community. You heard about you can't be what you can't see. I call that the mirror of relevancy.
As Black men, we're positioned in a really interesting way where our existence itself, we have to be very aware of how we interact with our surroundings and the way we interact with spaces. But this very fact gives us kind of an upper hand in understanding how people are seen and how people, want and desire to be cared for,
Oftentimes, you can't become what you don't see and what you're not exposed to. But I think a large part of it is that a lot of kids, when they grow up, like for me, right, I grew up in poverty, I come from nothing, right? So you're not gonna see physicians and just engineers and lawyers kind of walking around. So you have to get more exposure to seeing what the possibilities are and what the options are to really believe in your mind that you can really do it and achieve it.
When you are given guidance from somebody that looks like you are more likely to adhere from some of these comorbidities that we know that our population, our demographics, unfortunately suffer from more than other geographic populations.
I think that's something we missed the mark on when we say, how do we get students in, but how do we keep Black men in medical school and not disproportionately excluding them out of the curriculum that we see happen every day?
We shouldn't have to code switch to be the physician that we need to be. A lot of our culture thinks that you can't be hip hop and be a physician.
Places like this, AMEC, right? That's designed to help you really get the real tools, the resources, and the real, I guess I'll say, game that you need to be successful and to Sir Chair's point, not just get in to medical school, but matriculate all the way through the 4 years as well.
We want Black men to get into med school and to stay in med school, and that means also having the same resources, having the same opportunities that our fellow white classmates have.
When you walk in this patient room and they are literally excited that they have you there, you feel that you just made their day, I think really reinforced the power of being a Black man physician and a Black man providing care to patients who look like me and the impact that it can have.
From the pre-med perspective as well, I would say the number one thing is to get a mentor. The opportunity to have somebody that has done it, show you the way, show you when you're doing things wrong is invaluable. And also, make every experience count.
I think Black males in some ways are perfectionists. If you fail a test, if you do something wrong, if you take a little extra time, you talked about your journey, you take a little extra time, that's okay. You don't have to give up the dream. Just learn to be innovative and really just don't stop the dream because you see yourself look a little different or act a little different. Work that difference into the dream.